I think anytime we have a particularly complicated patient in the NICU who is having multiple organ systems involved, usually they have a breathing tube, they're on a ventilator, um, and they have this known high risk of death early on. I think that can lead to moral distress for the staff. There's a lot of questions about, you know, are we doing the right thing here? Are we just doing things to the baby instead of for the baby? And I think some of that can get clouded at times because the babies who tend to stay in the NICU a longer time are those that have more complexity. They have more respiratory issues and neurologic issues, cardiac issues, and we are not necessarily seeing those children with trisomy 13, 18 or other conditions who have less complexity, less birth defects, who then are going home. We don't keep them in our NICU because they're doing okay and they go home and we don't see them. And that's sort of a known bias in both the pediatric ICU, the neonatal ICU, adult ICUs. This is a known phenomenon that uh, we remember and we see the hardest cases, and they really deeply affect our bedside staff, particularly who are, our nursing teams who are at the bedside every hour of every day with these children and really worry about potential suffering that the baby is experiencing or the child is experiencing. And, coming back to a point that you made earlier a couple of different times, John, that what's really changed your perspective is seeing these patients and seeing these families in the outpatient setting, which as a critical care, team, we don't see them in that way. We don't see them when they're well. We don't go with them when they're at the playground with their sibling, and doing okay. And, maybe they have a G tube and a cannula and that's, what their parents have chosen for them, but we don't see them well for the most part. And that adds to the distress that people experience when, we also see those children who do die in the short period. And that's our frame of reference. And that can be really hard on staff, is helping people see that longer term sort of well child in their home environment where they're smiling and enjoying their, family dinners and reading books together and doing those sort of experiences that are incredibly valuable and meaningful for the family, for the child. We don't get any of that. And I think that really contributes to the challenge of caring for the sickest of the sick in the ICU.